Hello and welcome to Global Matters, a program that brings to you global issues which shape the world, issues of international and global agenda that determine our national common interests. My name is Tunde Alabi. Thank you for your time on the program, and thank God it's another Friday. Our focus today is on achieving herd immunity in Africa through mass vaccination of the population. The projection appears a very tall order for Africa as the rich countries of the world continue to buy and stockpile COVID-19 vaccines. The World Health Organization and the COVAX facility will be shipping 90 million COVID-19 vaccine doses to Africa in its first phase of COVID-19 vaccine delivery to low and middle income countries. While many African countries may have anticipated delivery of the vaccines to their doorstep, the World Health Organization recently announced that only 4 out of the 13 African countries that applied were shortlisted to receive the first batch of the Pfizer and BioNTech vaccines through the COVAX facility. Cape Verde, Rwanda, South Africa, and Tunisia were the countries that made the list. These announcements sparked concerns, especially in Nigeria, where pundits wondered why the most populous nation of the continent didn't make the list. But the World Health Organization immediately cleared the air that countries that failed to make the first list could get the Oxford AstraZeneca vaccines later. Although the WHO had earlier acknowledged that Africa is in danger of being left behind in the vaccines rollout as rich countries and other regions stockpile these all-important vaccines. The 90 million COVAX vaccines allocated to Africa will immunize only about 3% of the continent's population, though the African Union has secured another 670 million doses to complement the COVAX program. The continent is still far behind developed countries, which may have secured 300 to 400% more than the required amount of doses for their citizens. This seeming disparity drew attention of the former Liberian President Ellen Johnson Sirleaf and co-chair of the World Health Organization's panel for pandemic preparedness and response, who criticized how the international community is handling the distribution of vaccines. She said, despite the fact that scientists have been so effective in getting a vaccine ready for use so early, we now find that in the rollout, the wealthier nations that are well resourced are the ones that are going to get the vaccines. End of quote. On the program today, we shall focus on the intervention of the African Union in facilitating access to COVID-19 vaccines and how Africa can look beyond the West COVID-19 vaccines to develop African-owned vaccines. We shall also look at the odds against the African continent and the advantages in its fight against COVID-19. Can the AU shore up resources to secure more vaccines for the continent? Can it muster courage to invest in and develop African vaccines using the abundant natural resources in Africa? How can the private sector collaborate with national government to procure more vaccines? Joining us to speak to this issue is Dr. Ndukwe. Dr. Ndukwe is a family medicine physician in the Northeast Georgia health system in the United States of America, a COVID-19 survivor himself. And from Lagos, Nigeria, is Chika for Chika. He is the founder of Vaccine Network for Disease Control. My guests are standing by, and they will be joining me to speak to what we're talking about today. But before then, let's quickly take the short break. I'll be back. The world has become more connected than ever before. Every continent, color, race, language, and religion, even government, move towards common goals. We now live in a global village. Here on this program, we'll bring you global issues to shape our world.
Government can do a lot with tax revenues collected for health and education.
The role of the European Union is to accompany a partner, that is Nigeria, in offering our lessons learned to see whether together we can improve that situation.
The emphasis on education, on vocational training, on the development of entrepreneurship is absolutely critical to its democracy.
The Nigerian government, we would ask them to follow up the investigations that we have had, the evidence that we have gathered, and ultimately we made a number of recommendations.
As we travel the world, we explore these issues of international and diplomatic relevance. Indeed, the global agenda that determine our national and common interests. With me, Tunde Alabi, live on AIT. All right, thank you for joining us on the program. The program is still Global Matters. We bring global issues to you, and we go around the world to bring in our guests to discuss those issues. Today, we're looking at COVID-19 vaccines in Africa, a ticking time bomb. Joining me to look at this discussion today, I have Dr. Ndubisi, a physician at Northeast Georgia Health System, Georgia, United States. Dr. Ndukwe, thank you for taking the time. I'm sure you are at work. I understand that, but thank you for taking the time off work to attend to this program. Thank you so much. Your time very well appreciated, Doctor. Thanks a lot. And also, I'm also joined by Chika Ofo. Chika is the founder Vaccine Network for Disease Control. Chika, thank you for your time on the program today. Very well appreciated, Chika. All right, now let's hit the ground running. Let me start with you, Dr. Ndubisi Ndukwe. The last time we had you on the program, you just recovered from COVID-19. How does it feel now?
Well, again, I thank God for being for giving me the opportunity to be here, even up to today. The last time was way back in I think the first or second week of April 2020 that I recovered from COVID-19. At that time, we didn't have too much in terms of therapeutics. So I do attribute this completely to God for the reason I'm here. I have folks who have passed away, friends, and it has been quite surreal. And for that, every day I am grateful to be here.
May I ask you, have you got your vaccination? You
Yes,
are in the health sector. You're first class in the first charge of line. You got your vaccination. Tell me.
Yes, I did.
Yeah, go on. Go on.
I received my the first dose of the Pfizer vaccine basically on December 30th, and then I subsequently received the second dose of about 3 weeks ago. So that completed my 2 doses.
So does that mean you are effectively covered now?
As far as we can see or know, so far with the information that we have, we are at least up to 2 weeks after the second vaccine. Studies have shown that the patient is more likely to be immune to the various the variants of the COVID-19.
So you as a physician in a first charge of medical healthcare delivery in the United States, are you likely, even with your vaccination, to get infected again?
So I think that's a bit of a complicated question in that, first of all, for me personally, when I had that COVID infection resulting to pneumonia, it was quite severe, but I'm glad that it wasn't debilitating. So, but a few weeks later, maybe about 3 to 4 weeks after that, I did obtain an antibody test at the time, and I was found to have antibodies, but still not sure, how long that will cover in terms of immunity or what that exactly meant. So about 7 months later, I repeated that antibody test, and I was still positive. So, question was whether I should receive the vaccine or not. But having gone through what I went through and seeing what I see here in clinic, or having to send people to the hospital because they're sicker, or even having close relatives who almost passed away from this, I did make a point that I needed to get the vaccine updated. We do not know so far how long the immunity will last. There are some studies showing that, or some speculations that there's a possibility that we may have to receive these vaccines on a yearly basis, but until we get there, everything is still under investigation.
All right, thank you. So stay there. Let me quickly go to Chika. Chika in Lagos. Chika is the founder of Vaccine Network for Disease Control. Chika, let me ask you, how far do you think Africa can survive this COVID-19 before it gets its own batch of the vaccine? Bearing in mind that the rich country are snapping up this vaccine quickly and they are stockpiling them. Chika.
Oh yeah. The rich countries are snapping up the vaccines. They are taking all the vaccines and allowing us poor countries not to have vaccines. However, that's a joke. The truth is that what we have is that we are doing, and because we are moving as we speak, at least the African Union has been able to have at least we have access to about 670 million doses of vaccines that will be given to African countries that need them. So now when you're talking about Africa, you're not saying that Africa does not have access to any vaccine at all. Yes, we are 1.3 billion in Africa, so we definitely need at least 2.6 billion doses of the vaccine since you are taking two doses, But however, we're moving. So we have the 670 million doses that we're expecting through the strength of the African Union. Then we have the COVAX facility that is talking about 600 million doses of vaccine. We're not there yet, don't put that about that. But however, the plan is to be able to vaccinate at least 60% of Africans. If you're able to vaccinate 60% of Africans, at least we're kind of sure of the herd immunity process, So yes, we're lagging behind, there's no doubt about it. And it's not yet uhuru for us. But we're working towards it and we're trying hard, So I feel that we are coming from the back and we are slow because we don't have as much as the richer countries. But it does not mean that we're not moving at all. COVID vaccine is a dilapidating disease and it hit the world. Everybody was hit by it. For Nigeria, as we speak, we are over 200 million. What it means is that we need over 400 million doses of the vaccine. This is from a country where before we are talking of vaccine for about over 7 million children. Now we're talking of vaccine for over 200 million. It can't be easy to get. So while we're saying all this, I still want to reiterate the fact that all hands must be on deck. The most important thing in this vaccine, let us reiterate and talk about it. It is the purchase, the financial aspect of that is purchasing the vaccines. And the second one, the logistics for the distribution of the vaccine to get to the last mile. Because distribution at scale, those are the two important things. And that is what even AIT, we should start talking about, asking private partners, public-private partnerships, support at this time. So that is what I feel we should be working towards. And indeed, by the time you add 600 million to 670 million, that's over 1.2 billion. We're almost getting to have the mark. So we're lagging behind, yes.
Chika, Africa is faced with about 3 challenges here. We have the challenge of contending with rich countries to secure the required number of the vaccines for our population. We have the challenge of conspiracy theory, no vaccines, where they're trying to kill us, they're trying to eliminate us. And we also have, even where we have these vaccines sent to us, we have a logistic problem. Just the way you noted that we have the problem of storage. How do we deal with these other challenges we have in Africa? More importantly in Nigeria, to ensure that, look, before the arrival of these vaccines, we are not all dead?
Yes, like I said, it's not yet uhuru, but guess what? We're working towards it. First and foremost, the vaccines that we are going to...
How long is it going to take us for us to keep working towards this? Working towards this, people not dying every day.
No, from next month will be, I believe that we'll start having the vaccines. However, we should focus more on those vaccines that have the same kind of storage capacity as the ones that we're used to. So I don't really think that the Pfizer vaccine is, the storage for the Pfizer vaccine is very extreme cold, but we have the AstraZeneca one. The AstraZeneca one does not need the same kind of extreme cold for it to be able to be, for it to be viable. And then we have the Johnson & Johnson. So, my dear brother, the truth of the matter is that we are where we are. So we're going to take it as it comes. Luckily for us, in a small way, is that the vaccines are not coming all together at once. They're going to be coming in their phases.
All right.
So as they're coming in phases, we will be getting better at it and improving in our capacity.
What about the conspiracy theory that vaccines coming in are likely going to destroy us, kill us, make us, well, some say important, some say, well, we'll not be able to have more children again in Africa. How do we deal with that?
Okay, so it's not today they've had conspiracy theories. Even when we had the normal routine immunization vaccines, it was the same story. However, I don't think we should focus too much on that. Do you know why? Because the vaccines that are coming are not even enough to cater for at least 20% of the population yet. The vaccines that are coming, we have to take care of the frontline staff. The frontline staff are not quarreling about the efficacy and the importance of the vaccine. As the frontline people take the vaccine and they see that nothing is happening to them, then our leaders, not all, I note, our leaders like the president and the governors and all those other ones take the vaccine and nothing happens to them. I can assure you other people will take the vaccines.
All right, thank you so much.
I think that for me, yeah.
Thanks a lot. Let me go to Dr. Ndukwe. Doctor, still the same question about these conspiracy theories moving around the world and the rest of it. How is the government in the United States? Because I'm aware that the ethnic minority communities in the United States are very careful. They are not very well open to vaccines. How is the government and those of you in the front line dealing with this fear of vaccines?
Well, personally speaking, that is of a big concern. I noticed that even within my extended family here in the United States. We do know that there's a disparity in both the severity of the condition affecting Africans in diaspora and as well as general minority groups. We have seen that. At first, we had the conspiracy that, hey, this did not affect African Americans at all, but that's not the truth. Here I am. I'm a living testimony to that. So it is a challenge in that we have to do everything possible to relay the information the right way, starting from information relayed through social media. You know, personally, I try to reach out to my friends and colleagues. I'm in a WhatsApp group where we have these discussions. I'm in one of my high school, secondary school group where I had discussed this with them, and we had a forum about this, and they had questions about how sure are these vaccines effective or safe. And I tell them, look, every one of us has received over a dozen or more than a dozen of vaccines over their lifetime, and here we are. So we have to look at the benefits versus the risk, or the said or supposed risk of receiving a vaccine. Talk less of the COVID vaccine itself. Remember that, you know, this technology or the new technology with regards to developing these new vaccines, they have been there already over the years. They were just waiting for something like this to happen. Unfortunately, that happened, but there are also studies. Remember that there are folks who had to go through this research to be tested, and they did well over time. So if you look at cases like in Israel, you hear that over 500,000 recipients of the vaccines have done quite well, and that's a true testimony to how effective this vaccine is. Yes, we do know that there are some of the vaccines that they seem to be questionable to certain variants, but we are looking, we should be focused on is to decrease the severity of a COVID infection.
All right.
So if we can get a lot of people to get vaccinated, that definitely would increase the ability to reach herd immunity.
Doc, let me quickly, this question to you in 1 minute. You are an African man, even though you're American. Do you believe in herbs? Do you believe in herbs? Do you take herbs?
I do.
You do take herbs?
Herbs, with regards to condiments to cook, absolutely. I cook with that. I cook all the time. My family can bear testimony to that. And I don't want to delve into that because that could open up a bag of worms. But I do think that, these herbs or certain herbs, we know that some of these herbs are made, and that's how certain medications were either developed over the years.
Absolutely.
Now, that does not mean that research, is complete with regards to directly affecting COVID itself. Now,
Absolutely.
Can herbs help with the symptoms? Can herbs help with congestion? Absolutely. But we cannot put the complete reliance on a particular herb to do this or that. What we are doing, or what we are putting ourselves in a danger, is to complicate our organs. If you are over medicating yourself with certain herbs, well, you can lead to liver toxicity. So that's just one example of that. Yes, I cook with herbs that my mom sent to me. My mom is visiting here, and I have them in my freezer.
I thought as a medical doctor you just take some pills and being an American you just even bother about herbs again. So you still take those stuff?
Well, yeah, I do. I mean, in terms of cooking, I do, but I'm not taking it in order to prevent COVID.
All right, thank you.
No, I'm not doing that. Yes.
Let me turn to Chika. Chika, I mean, you heard the testimony of Dr. Ndubisi. Do you believe in herbs? Do you take herbs? Do you think Africa can actually look inward, the herbs, the natural substance out there, and develop our own vaccine? Do you think so? Rather than killing ourselves competing with America and Europe for their vaccines?
Yes, I believe that after all, even the people that are making headways in America and all those places, some of them are Nigerians. Dr. Ndubisi we're talking to now is helping Americans, and he's a Nigerian. So that is where it's really painful for us, our best hands. However, I believe in herbs because we grew up with herbs. However, coronavirus is a novel disease, a novel virus. So, and because it has not happened before, you don't know which herbs to use. If in those days we had the malaria herb, dogoyaro, all those things for malaria and all that. But corona is not malaria. Because it's not malaria, and we don't have any research institute really that goes to research and look for how to improve the herbs to treat this thing. It will be foolhardy for us to fully depend on the herbs.
All right, thank you so much, Chika. Thanks a lot, Chika. I have run out of time. I'm probably going to bring you guys back again. Dr. Ndubisi, thank you so much. I had to pull you out of work to be part of this program. This is very appreciated. Thanks a lot. Physician, Northeast Georgia Health System, live from Georgia. Thank you, Ndukwe. Chika, thank you also for your time today. Very well appreciated. We hope to bring you back again.
Thank you.
I should not say, or I should say, guys, you keep safe and happy weekend. Enjoy the rest of your weekend.
Happy weekend. And I'm from Abuja, not Lagos.
All right, Chika. Okay, from Abuja. Catch up and see you very soon. I appreciate to the team today. Thank you so much. Enjoy the rest of your weekend and keep safe.